Hey there, viewers. It's time to get into a subject nobody wants to tackle: prostate cancer. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? The United States alone projects over 260,000 new cases this year alone. Luckily, there are signs. Let's talk about some of them today. Does it burn when you pee? Are you losing control of your bladder? Wait, is there blood in your urine? We're talking about all of that and more. You have blood in your urine. When you go to the bathroom, do you ever get paranoid that you're going to find blood in the toilet? It's a thought that's gotta cross your mind every now and then, especially as you get older. With prostate cancer, blood in your urine is one of the most common symptoms. It doesn't just catch you off guard, it makes your heart skip a beat. Before I go any further, I think I just need to clear up exactly what a prostate is. Located just in front of the rectum, the prostate is a small, walnut-sized gland between the bladder and the male genitalia. The urethra runs through the center of the prostate, letting the urine flow through the bladder. With prostate cancer, the bladder becomes enlarged, so large that it actually presses up against the urethra. This causes bladder irritation and leads to bleeding. If you notice blood in your urine, try not to panic. It's easy to jump to conclusions in situations like this. In some cases, blood in the urine could point to an infection in the bladder or kidney. But this doesn't mean that you should hesitate to see a doctor. You need to get to one ASAP. If it is in fact prostate cancer, the blood could mean your cancer is at a more advanced stage. Leaky pee when you laugh or cough. This description might sound humorous, but it's anything but. Also known as urinary incontinence, leaky pee can happen when there's stress placed on the bladder. While this is usually common with people who've had prostate surgery, it can be a symptom of prostate cancer pre-diagnosis. All a person needs to do is laugh or cough for this to happen. Physical activity will also cause leaky pee. You'll be lifting a heavy box and randomly start urinating. This can be both embarrassing and frustrating, but if you have no history of prostate cancer, you need to be concerned. An enlarged prostate could be doing serious damage to your bladder. You have to urinate sitting down. If you're experiencing extreme pain in your prostate region, it's going to be hard to pee standing up. The pain in your pelvis has become so overwhelming, standing is a task. As a result, you're going to feel like you have no choice but to sit on the toilet to do your business. Unfortunately, this only erases the pain for a short amount of time. As soon as you stand back up, the pain will continue. It's best to talk to your doctor ASAP. Your bathroom trips have doubled. Are you finding yourself rushing to the bathroom out of nowhere? We all have those moments, but if you're urinating more frequently than usual, you may need to get your prostate checked out. Now, frequent urination can be brought on by a lot of things. Before you jump to prostate cancer, make sure you rule out the possibility of drinking a little too much fluid. Things like water and caffeine are diuretics that can have your bladder draining out like a faucet. It's normal to pee 6 to 8 times every day. If you're going more than that, you should probably cut back on the fluids. If it's actually prostate cancer, you need to get it checked out as soon as you can. Your prostate is putting massive pressure on your bladder, which is pushing the fluid out quicker than it should. It's the same reason you leak pee at random moments. If you're noticing that your urination rate has increased, pay attention to the time it's happening. For most people, the urgent trips to the bathroom will happen more and more at night. If this is the case for you, we would recommend to get your prostate rectal exam. This way, you can find out if your prostate has become enlarged. There's pain in your rectum. Prostate cancer can cause rectal pain. Mind you, it's more common after you've had surgery. If you're experiencing endless pain in your rectal area, it could be a sign of undiagnosed prostate cancer. This is again due to your enlarged prostate pressing against your bladder and rectum. Now, rectal pain can be constant, but it gets really bad when you sit down. Think about it. You have an enlarged prostate pressing up on the rectum on one end, and now the seat cushion pressing up on the other. Before you jump to prostate cancer, keep in mind that rectal pain is caused by a few other factors. You also need to consider hemorrhoids. Hemorrhoids can cause unbearable pain on your rectum. On top of that, things like inflammation, infection, and trauma can also be behind this pain. The odds of it being rectal cancer is actually kind of slim. At the same time, if the pain doesn't let up, you might want to see a specialist who can diagnose you. You're having a hard time stopping your pee. Let's just say when you have prostate cancer, peeing is going to be a lot harder than it used to be. Aside from all the extra trips to the toilet as well as blood in your urine, you may have a difficulty stopping yourself from urinating. Have you ever been mid-pee and had trouble stopping? Most of us can do it automatically, but when you have a prostate issue, you don't have as much control. While this is another side effect of prostate surgery, it can very well happen before you even get diagnosed with cancer. Prostate cancer, as well as its treatment, can damage all the nerves and muscles that help control our urine. You're not peeing as much. While prostate cancer can increase the amount of times you urinate, it can actually work the opposite way as well. Prostate problems can also stop you from peeing. This is known as urinary obstruction. If you're able to pee, it's coming out in small dribbles. In the case that you're actually unable to go at all, it's a medical emergency. Keep in mind that the state of your urethra is key in urinating. If your prostate is pressing against your urethra, it's going to cause blockage, making it harder to pass urine. As a result, your pee may only be released in small amounts. This could be one of the reasons your bathroom visits double over the course of the day. Your bladder is patiently trying to get all of that clogged up urine out of your system. There's pain in your lower back, hips, pelvis, or thighs. Not all symptoms deal with urine and the rectum. Prostate cancer comes with extreme pain in the bones. This pain is the most common in the pelvis area, lower back, and upper thighs. This happens when things get really bad. If the pain is in the lower back, it could mean that the cancer is spread. This is known as metastatic prostate cancer. When the cancer is metastasized and gone elsewhere in your body, the survival rate generally drops. This is why it's important to get treatment ASAP. A study from 2013 showed that men with lower back pain had a higher rate of prostate cancer than men without it. If you're experiencing this type of tension in your lower back, you'll probably also have it in your pelvic area. Have you ever heard of CPPS? This is short for a condition known as chronic pelvic pain syndrome. Around 95% of men with inflammation in the prostate region experience CPPS. These men usually suffer from this condition for up to 3 months. It's said that even after treatment, you may still experience symptoms. On top of the lower back and pelvic region, you'll also experience upper thigh discomfort. This usually comes from deep within the bones and muscle tissues. There's a smell of urine coming out of your underwear. If you have prostate cancer, don't be surprised if you notice a really gross odor coming from your underwear. It's pee. It usually comes late at night after you undress yourself for bed. If it's particularly strong, you may even get a whiff of it during the day. This odor is due to the urine leaks we're talking about from earlier. If this happens to you, don't panic. It's a pretty common symptom. You have a high PSA count. You probably don't know this, but all men have small levels of a specific antigen in their blood. These are known as prostate-specific antigens, or PSA. While a small level of these PSA is common, a large amount could point towards prostate cancer. This is why it's important to get a checkup if you're concerned about your prostate health. You see, there are 2 types of PSA, free and regular. Generally, guys with high amounts of free PSA don't have prostate cancer. It's the regular ones you have to watch. Regular PSAs are produced by malignant cancer cells. When you go in for an exam, your doctor will give you a screening for PSA and figure out what's going on. This is done through a blood test. If you're a man of 50, PSA screenings are usually part of a routine checkup. Cancer is one of the scariest things a person can go through. It's something most of us worry about a lot. Let's keep the conversation going with a couple more cancer-related videos, shall we? Here's what you need to know. Check out 12 cancer-causing foods you should not eat. Or how about 12 signs of cancer mostly ignored by women? Go ahead, click one, or better yet, watch both and learn more about how to prevent cancer. Have you or anyone you know ever experienced prostate cancer? Let us know in the comments below.